Welcome back, everybody, on this Friday morning. Let's focus in on the National Education, Health and Allied Workers Union, saying it is on course to down tools at hospitals across the country come the 10th of September. The union has been complaining about a lack of personal protective equipment for health workers since the onset of the coronavirus pandemic, as well as other grievances. Joining us now to talk a little bit more about this, we've got NEHAWU's Deputy General Secretary, December Mavuso. December, great to have you. Thanks for your time.
Good morning. Good morning, Leah.
Let's get an update from you. Last week, you met with the Health Minister, Dr. William Kize, to discuss some of your grievances. You say the meeting could not resolve the substantive issues that were sitting on the table. Let's talk to those issues. What were they?
Well, Leanne, as you said, since early in March, we've been raising issues with the Minister and different MSCs on the protection of workers. We agreed on a number of things, which most of them were not implemented, including the whole issue of making sure that there's adequate provision of PPEs, but that the issues of workplace safety is taken care of. There's an establishment of occupational health and safety committees, and that workers actively participate, because that's where you deal with issues of risk assessment, identifying hazards, implement prevention and control measures, including dealing with the issues of the PPEs, education and training of workers in terms of protecting themselves against the virus. There are other issues which came out of our fact-finding mission, which we undertook between April, June and July. The report was handed over to the Minister. That's the day before we unveiled it to the public on the 28th of July. It raised other issues, exposes the whole issue of the shortages of staff. We raised issues on what we call destabilizing management, attitude in different institution management capacity in responding to complex situations in our workplaces. The whole issue about the dysfunctional district health system that we raised, and how decentralized response to the pandemic has caused problems in the country, in particular the procurement of PPEs. And we made several proposals in terms of how to remedy some of these issues. But to our surprise, in the meeting with the Minister, they focused on two things only. The rest of the issues we raised, they didn't even care to respond to them. They just talk about the issue of the PPEs and the fact that, there's improvement in certain provinces. For instance, they make an example about Mpumalanga, which they said is at 70% in terms of stock, and other provinces at different levels, which we had a problem with that. Secondly, they sang a song, all of them, about the fact that occupational health and safety committees are established, something we contested. We told them, you can't come here and lie to us, because we from the ground, we've spoken to workers, we've spoken to management. Yeah. The situation is such that there isn't those things, where they existed, they have been rendered dysfunctional by some management. So they are not given space to function. Mm. And even those managers, most of them, they have displayed complete ignorance of the legislation when we were asking them about the Occupational Health and Safety Act and the employer's responsibility. Because the Occupational Health and Safety Act creates two responsibilities. Firstly, the duty to care from the side of the employer, not just for employees, but for visitors, for users of the system, for the community. So, secondly, it creates a duty to inform, meaning there must be transparency, there must be open communication and so on. And we found in this institution that information is hidden, workers are not being involved, there are infections of their fellow employees. They are told to hide that information. They are made to sign secrecy forms or confidentiality forms in many of these institutions. Workers are scared. They are victimized. our shop stewards are being charged, for raising these issues and so on. So it's just a chaos.
Yeah. It's quite. Let's delve a bit deeper into that, because some of the things that you're telling us, that is, it's very unfortunate when, as you say, these are individuals that are going out every day trying to help South Africans and save lives. Whereas when we look at the numbers, and I know I'm going to quote a couple of the numbers, perhaps they've been updated since then, but I'm not necessarily saying your members alone, but in general, in the healthcare sector, these numbers were released on the 4th of August, and they talk to how severe the situation has been within the healthcare sector. So the total number of healthcare workers that have been infected and tested positive for COVID-19 are 27,316.
Yes.
Of those, 21,333 come from the public sector. That's 78% come from the public sector. Within the private sector, there's 6,027, and that's 22%. There have been a total of 230 deaths from COVID-19. It doesn't say where exactly they come from. I'm not sure if this figure is increased, but this is a high number.
It's too big a number. In fact, that's the point we made with the minister, is that this number is not correct. From what I am telling you now, that there's a lot of concealing of information. We had a meeting with the National Institute of Occupational Health, which is an institution of the Department of Health linked to NHLS. What they're doing what we call data surveillance, and they've been trying to get all health institutions to feed data to them on the daily infections of health workers. Out of more than 300 institutions, only 18 feeds the data to them. And they've raised a concern about, the reliability of that particular data. But you know that just a week ago, MRC, working with one university in Cape Town, they've raised a concern about the figures in the Eastern Cape in terms of the infections of workers. They say that figure of 2,000 is incorrect. It should have been more than 8,000, in fact, according to the data surveillance they've done themselves. So it's just the number is not what we are presented with.
Really? Yeah, because the minister went on to further justify that, saying that if we break that down in terms of a global stat, so it's interesting to hear from you that you don't believe that those numbers are actually correct, that they actually are higher than what is being reported, because the minister is saying that basically only accounts for, and I hate using the word only, but this is the way, that it only accounts for 5% nationally of the infection rate, whereas amongst healthcare workers, but internationally, that sits at 10%. So you're saying that you don't believe this? That figure is much higher.
We don't believe that, but even 5% is too big a number for your health workforce. That in fact is not even enough. We have serious shortages of the workers. Imagine, let's take the 27,000 and say it is a correct figure. At some point, the 27,000 health workers, they would have been in isolation or quarantine. Now, that depletes the already depleted workforce in the public service. There's no filling of vacancies. The shortage of doctors, the shortage of porters. Nurses in many institutions find themselves doing porter work. They find themselves cleaning, the wards and so on. So it's a big problem.
Yeah.
It's a problem. COVID-19 has exposed the reality of our health system, and the fact that we made wrong policy choices. We always talk about health as a apex program, including education, but there's no investment, to make sure that that those systems functions optimally. There's continuous talk about laying the ground for NHI. You can't succeed if we continue like this. The infrastructure in our institution is very bad. I went to George Mukari Hospital, which is an academic hospital linked to Medunsa. It was shocking to see what was happening there. The minister went there himself, but he continues to deny the situation on the ground. We've seen
so much coming. I know here at the SABC, we've focused on a lot of the hospitals and with particular attention to what's happening in the Eastern Cape. And some of the dire circumstances that the nurses and the doctors work under. In fact, when you look at the numbers that are coming through provincially, I'm not necessarily focusing in on the infection rate and those that have gotten infected. I'm looking at the fatality rate, and what really concerns me is what's happening in the Eastern Cape. It says that these are older figures. I'm talking to the beginning of August, but I'm sure you may have more, or maybe this is underreported, but 85 healthcare workers, including doctors and nurses and everyone else, 85 alone in the Eastern Cape have died. That's got to raise alarm bells.
Leanne, nothing is working in the Eastern Cape. The Deputy Public Protector the other day, when they confirmed exactly what we've been talking, there's a new thing that is emerging in the Eastern Cape, which we're trying to follow. Workers have been telling us. We met with nurses 2 weeks ago. They're telling us that for every nurse that gets infected in the Eastern Cape, the partner or husband to that nurse dies. Now, it's further complicates the problem. So you see, these nurses are vulnerable. They are at greater risk, but they also, infecting their own family members. It's an unacceptable situation. But as I say, nothing is functioning in the Eastern Cape. A lot needs to be done there. And a lot of focus has been placed. The minister has been in the Eastern Cape many a times. We've been asking a question exactly when he is there together with the Premier and the MSC. What is it that they are checking in this institution? What is their checklist? And when they've done that, what interventions, to change the situation on the ground?
Yeah. We look at where we are with the numbers right now in South Africa, and they are decreasing. We're seeing the infection rate is coming down, and this is obviously now through. We can't say we through the worst of it, because we don't know what the road lies in front of us, because we talk to secondary infections, a second peak, or whatever it may be. But as it stands right now, the caseload is coming down, but that does not serve any purpose for the healthcare workers, because they're still facing it every single day. Whether they've got one case or 100 cases that come in at the same time, they are still at the front line of all of this. Has anything improved in terms of the PPE? Because I see clearly, I can answer the question myself, because the answer would be no, because you're planning pickets next week. So this is obviously saying that there is still a major situation with a lack of PPEs.
There is improvement here and there, but generally we found that there's a problem across the board. That is why we're unhappy with the report we received from the different provinces in the meeting with the minister last week. We then agreed that the process of verification of some of this information must be undertaken between our provinces and the HODs and MSCs the whole of this week, including verifying their claims that we have functional occupational health and safety committees. We're waiting to see. Remember, Leanne, 2 weeks ago, the minister had said that he has appointed a task team that is going to go investigate and give him a report within 14 days. In the meeting last week, we asked him a question. So are you now abandoning that process because we are no longer talking about it? And are you saying to us you believe what these MSCs and HODs are telling you? That question was never responded to. Nevertheless, we agreed, let them engage with our provinces. So we will receive a report by end of the day today from our provincial structures, what has come out of this engagement, because we're returning back to the meeting with the minister the next 2 weeks. But until then, until then, the situation remains the same. Workers continue to complain. We have taken a decision that we will continue to protest, engage in this campaign until there's serious change in terms of the working conditions of these workers. These issues of infrastructure, of PPEs, it is addressed. There's clear plans what's going to happen.
Otherwise, come the 10th of September, there will be a nationwide shutdown of the health sector. Is that what I'm understanding? That down tools and
exactly.
That'll happen. A lot of people and the health minister as well has called the pending strike irresponsible during a pandemic, a national health crisis. Some might agree with them because people may die. What do you have to say with regard to this criticism?
Well, what choice do we have, Diane? We've from March, we've been knocking in the doors of the minister. And we were promised certain things are going to happen. Since March, we struggled to get hold of the minister until when we threatened the strike and he came out and agreed to meet with us. People are dying already. Workers are dying, Unfortunately, we are put in this position. It's not something we've planned. It's not something that we want to see happening. But the issue of leadership failure here, it's a problem for us, Workers are looking at us, defending their rights, protecting their lives, because this is also about the lives of these workers. COVID-19 has not, taken away the right to life of health workers. Neither it has taken a right to life of any citizen. So it's also not, and I've just said to you that the duty to care from the side of the employer is in both ways. It's society and workers. This is our struggle is also about protecting the society, because if you don't protect these health workers and hospitals become the breeding ground for infections, society is at risk. Yeah.
Salaries is also a very big contentious issue. This has been, and we do know the situation. We know that you're talking about the fact that government has undermined the implementation of a resolution that was decided on in terms of the salary increases. We know the financial situation of the country, and government talking to the fact that they don't have the available money to go ahead with these increases during this crisis. Is this good enough reason for you? Are you still concerned? I know you're worried about the PPEs, but we haven't even touched on salaries as yet.
We must believe that government does not have money when money is being looted, during this pandemic. People are stealing millions and millions of rands, through corrupt processes in our procurement system. So workers must believe that, must accept that. We don't think so, Liane. This is an agreement signed in 2018, and nobody was drunk at the time when the agreement was signed. We hear that some ministers are saying the agreement was signed by somebody who was drunk. Well, nobody was drunk. Not even the ministers who were involved were drunk in our view. But and we think that that's a very irresponsible statement also to make. But the same government put aside money for the first 2 years. The agreement was implemented without any problem. They should have prepared for the last leg of the agreement. There's no excuse that they entered into an agreement voluntarily. Nobody held a gun, to anyone. Head to sign the agreement. So we don't take that alien.
December drunk, Minister drunk when they signed the agreement? Who? What was that all about?
No, there's a statement that was attributed to one minister who says the person who signed the agreement in 2018 was drunk.
And
who signed on behalf of government?
Who was the person that signed that was allegedly drunk?
Well, I don't know. That's why I'm saying, as far as I know, we were involved in the process. Nobody was drunk.
Okay. All right. That puts a whole new spin on it. But thank you for talking to us. That was NEHAWU's Deputy General Secretary, December Mavuso, talking to us about the impending strike at hospitals nationally, which is planned for next month. They say the 10th of September is where they're going to be putting tools down and not going to work as members of NEHAWU if their demands are not met for PPE and also, of course, the talk of salary increases. But from next week, there will be lunchtime pickets. All right, that leads us up to 7 o'clock.